Welcome to both David and to Richard. If you'd like to just introduce yourselves first, and then what we're going to do with each cabinet member is I just ask you to give us a little introduction into the budget proposals that you are putting forward, and then we'll go straight into questions. So over to you first, Richard.
Okay. Councillor Richard Livingstone, Cabinet Member for Adult Care and Financial Inclusion.
David Bushforth, Strategic Director for Children and Adults.
Okay, it's probably worth recapping where we were this time last year. This time last year I was telling you that we discovered in year that we had a £9.5 million deficit back in July 2016, and that we were confident we'd made some partial recovery to that, but we were still going to be overspending by £7.5 million for the 2016-17 financial year, and that is where we ended up for the year. So some significant challenges that we needed to put right, and the budget last year was identifying how we were going to make some savings, how we were going to find additional resources to do that. Clearly this was a story that was happening across the country with the pressures for adult care, particularly coming out of issues I think around the NHS and hospital discharge was a key driver in all of that. So we agreed savings last year of £5.5 million, and in addition there was some one-off money of 1.6 million roughly, one-off money to help provide a bit of space for recovery. But that is clearly what we've been aiming for this year to get on top of, making those savings of £5.5 million and being able to find a way of relieving that pressure that 1.6 million was covering, because it's a one-off cost. And so I'm glad to be able to report that, given the budget recovery process that was touched on earlier, but we've managed to achieve that. And I think there's been a tremendous work that's been done in the department and with colleagues in finance to enable us to get there. And I think that's because we have had a process very rigorous. Kieran last year I think was very keen that we actually had milestones in terms of when savings are going to be delivered, for example, and that has been helpful in the process. I think one of the really key things is people understanding what the budgets were they were responsible for, which I think ties in with Councillor Ali's point, and feeling they had the sort of responsibility and the confidence to do things to address issues within it. So, and that's been really important. I think what's been very encouraging for me as Cabinet Member is being able to see not just the very top, the Davids and the Jeanettes and the Jays of this world understanding the need to reduce budgets, but actually that filtering all the way down, and people in charge of teams, at the sort of real chalk face of delivery, being able to take on board those responsibilities and doing that. And so overall we'll be coming in within budget this year within adult care. Obviously that's within adult care and children's services overall, and there's a journey to go on children's services we've heard. And that's despite the fact that we have in the year agreed that we'll be taking on the sort of all ages disability service as part and parcel of all that, which is probably an additional cost pressure over and above in the budget of possibly about £1 million. But we've been able to find the ability to do that and still make the savings and still get to the place we needed to. So the recovery has been very strong, and we've been able to get ourselves to a very sensible place. Now clearly a lot of that has been helped by government recognising it's a national problem, IBCF being there, and obviously the budget you've got in front of you today identifies that IBCF resource and then sticks quite a lot of commitments against it, because obviously government doesn't give us money for free, it gives us money against us having to do things. And so there's quite a lot of commitments against adults. You'll see it's £19.7 million worth of commitments in the budget, which is tied into the fact that we're getting the money in from IBCF and also the proposed adult care precept of 3%, additional 3%. Just really to cover the savings that are identified, I think what we are clear on is, given our experience of recovery over the last year, that we're confident about the savings that are outlined as part and parcel of this budget. We know through the management action that's taken place in year that we're confident that we can reverse out that 1.577 million that was put in there as a one-off resource last year. We know In terms of our income collection, we're confident that we can collect another 800,000 in terms of fine contributions over the year ahead. We're confident, given where we've gone in terms of the adult social care reorganisation within our teams. Pretty much, I mean, I think it's about 1.6 million we've achieved this year, but of course some of that happened part the way through the year, and so the full year effect is pretty much that £2 million already. So that's a bankable saving already in where we are at the moment. And the final areas in terms of the integrated pathways for disabilities, well, we're at the moment, we're just at a sort of gateway zero stage at the moment, looking about how that would go. But I think it's worth recognising that one of the key challenges that we have there is against 178 people with learning disabilities that we have in residential placements within Southwark. We've also got 117 that are placed outside of Southwark. And that's not the full picture about how we need to get this right, but it's clear that actually we're doing things which would be improving people's lives that might be saving money as well here, and that's clearly where some of our thinking is going. That's where the Gateway Zero process will take in terms of learning disabilities. So that's a quick canter through where we've been, where we're going to, and the savings proposed in the budget.
Thank you for that. So I will start on the last thing you mentioned there, which is disability pathway budget. So that's sort of line for reference. That's reference 405 there. Just make sure I'm matching this against the right stuff. So the disability pathway, that's about. Is that about the pathway from children with disabilities who then become adults with disabilities, and about the transition between those 2 points? That's what we're talking about here. It's about putting in investment to ensure that we get that transition right. Am I understanding that correctly?
That's certainly part of it, but it's more broadly than that, about looking at all the sort of services that we provide for people with learning disabilities, other than obviously daycare provision, which we have, as you'll be very much aware, we've done during this year. But yes, it's looking more globally than that, but as you say, that's a really important element of it.
David, you want to say something?
I think I would describe it more radically. So all age disability means that we're bringing together our children with disabilities team and service, our transition service and our adult disability service, both for people with learning disabilities and physical disabilities. What we're trying to do is to stop moving the cliff edges that parents and people describe to us about when they move from children's to adult services. So rather than focusing and investing just on the transition, what we've done is we've brought all those teams together and said, you're now one team. Stick with David for his life journey, and no handoffs throughout that process. So I think that's really important for the ethos of the team, because bringing it together means the focus is on lifelong opportunities and fulfilling lives for people, including employment, housing, relationships. Whereas up until now, it's always been very segmented. Your experience as a child, your experience as a teenager transitioning, your experience as an adult. And the feedback we've had and the various reforms that have been attempted over the years, including the most recent reforms by LAM in terms of special educational needs, just haven't delivered the experiences for people that we'd hoped for. So we're doing something that a couple of other boroughs have done. We're not the first, but we're very, very early in that kind of group, where we're saying, do you know what, we're just going to scrap all those artificial arrangements and have one team of experts, social workers and other professionals, who will receive people in at any point, not just when they're young in the borough, but when they come into the borough, because there are lots of people coming into the borough at various ages with disabilities, and they're held by that one team for their whole life journey. So we're creating something quite different, quite radical, and which we believe will help us to have more constructive and positive relationships with people and their families, because they won't feel they have the system to battle around eligibility and around transitions and changes. So the team are very, very excited by it. The Institute of Public Care at Oxford Brookes are helping us with it. They're facilitating that. And we've reached out to health colleagues to involve them to be part of that as well. So it will take us a couple of years to fully embed it, but really, really, really excited about this there. And investment going in for this budget proposal.
It sounds like an excellent initiative. Sounds like the kind of thing, exactly the kind of thing we should be doing. It does, I assume, also contain within it the possibility that there are going to be extra cost pressures. Are you confident that we've got in place the right safeguards to make sure that this new approach isn't going to create overspending of its own? Have we got the monitoring in place to make sure that doesn't happen?
I think for me the starting point is always around practice, and the monitoring and the management has to follow and tightly hold that. So I think at the minute what we have is a dysfunctional system where parents have to fight to get their children labelled to be eligible for services. And in that tussle, some honesty is lost. And so I think not just in Suffolk but nationally, I think there's money being spent that doesn't necessarily get the right kind of outcomes. So I think the starting point is already quite low, aside from the human heartache and hassle and grief that goes with that. And I think by having taking down those barriers, I do believe we'll be able to have more honest conversations with people about what David needs and what we can do for David, but also what David and his family can do for themselves. So the example I'd give is the changes in policies around transport, which mean we've invested a lot more in independent travel rather than just paying for transport, because young people don't just want transport when they go to school, they want transport in evenings and weekends when they can go and see their friends. So when we approach it in this kind of battle zone of policy and different things, people stand their ground and they say no and they won't engage in it, and they get frightened, they get very, very frightened. Whereas in this newer space, we believe we can have much better conversations. The other thing to say on this is that in adults the history is one of personalisation and direct payments. In children's that's not really the case. And we do believe that by moving more in a personalised way, all the evidence suggests that doesn't cost us more. It doesn't save us the kind of money folks said it would, but it doesn't cost us more. What it does do is it really empowers people with disabilities and their families to live the lives that they want. So I think there is a monetary value on that in the system, and it shouldn't cost us more. I think it may help us to spend our money much more wisely.
Thank you, Gavin. Two questions. The first one is reference 106, on page 41, where we talk about the reorganisation of adult social care teams for modernisation, and that seems to have quite a large number attached to it. And I guess I'm interested to know how we go about doing that when there are obviously challenges around kind of ongoing staff retention. Also, obviously, we've had some discussions about moving insourcing some services, and kind of what that looks like and what the breakdown is between services we're still going to use people like Slam for compared to services that we're going to bring back in-house. And then the second one is about the ethical care charter. I can't find a reference at this moment in time, but I'll find it in a second. And about how we've managed to ensure that we're not having to increase the contract values significantly whilst having to deliver on the ethical care charter, and are we confident that we can deliver on the ethical care charter whilst still getting contracts that will provide the right support for both the service users and for the staff?
Okay, I'll start on that, and I think Dave can then sort of flesh out some of the detail. I think in terms of the savings, this is pretty much effectively realising the savings that we've made in year during management action largely. As I said, I think it's about 1.6 million we saved in year. Part of that was a part year effect, and so we're getting pretty close to 2 million already just in terms of savings. Just looking at Tim and Jeanette, who are nodding furiously to sort of reassure us on that point. So effectively it's the changes that we've already been able to make and effectively following that through.
Richard, sorry to interrupt. Could you try borrowing David's for a second, just to see if we stop it? You turn yours off and turn David's speaker on. It seems to be that speaker in particular
Right.
which is causing the problem.
Okay, is that better?
Yeah.
Okay. So the second question was about the Southwark Ethical Care Charter and the budget implications for that. Well, the budget we agreed last year actually included some additional money for the ethical care charter, so that was taken into account when we went through the process of retendering. The interesting thing is that actually, because it was so competitive, that the values that we got back in terms of the successful bidders were probably slightly less than we'd anticipated for and budgeted for. so we think, if anything, we're we'll have to see how mobilisation goes and what the implications of mobilisation, whether anything comes out of that. But we're comfortable with the budget that we set aside in last year's budget should be able to fully meet implications of the end of the care charter.
Just a couple of brief points to add to that. Then, in terms of line 106 and the £2 million saving, that, as Councillor Livingston said, is largely delivered already by reorganisation that's taking place this year. And just to spell out, that happened in older people's services. That was not in our disability or services. That was all contained in older people's services, which meant we realigned our qualified staff, our unqualified staff, invested in trusted assessors, worked with the voluntary sector. So we've reprofiled our staff and we have reduced it. But what I would say is that we've been very sensitive to the impact of that. And if I, for example, reflect on our hospital discharges, at King's and GSTT and SLAM, our hospital social work teams are a third less than Lambeth's. What we did was, before we made those reductions, we made sure that our practices were very lean, our management was very good. And so on delayed transfers of care, we're fourth best in London. Whereas, for example, Lambeth, which is a third more staff, is sixth worst in London. So I think it is, it's the very same hospitals, very same clinicians, very same process. So I think it is worth us calling out, celebrating, and thanking colleagues for the way that they're working to deliver that. It is really tough. It's really pressured, but that enables us then to invest money in the Cinderella part of social care, which is the independent sector that's providing home care and daycare to the residents of this borough. And one of the reasons why I believe we've been so popular in getting lots of interest in our home care contracts, because our civic ethical care charter could not be further from the reality that these companies and the organisations are facing everywhere else. Most of the councils have brought in the big four accountancy firms across the road in to screw their budgets right down and to try and get people to pay less and less and less for more. We are the complete opposite to that. We're going to the sector saying, we'd like to invest money and we're going to tell you where we're going to invest it. We're going to invest in the wallet and purses of home care workers. We want guaranteed hours, not 0 hours, and we want people paid London living wage for travel. This is so radically different from what everyone else is getting that we're happy to and comfortable to talk about 3 to 5% profit and operating profits for charities and for businesses, whereas everyone else is trying to squeeze that out of them. So it's partly an indictment on the sector and what's happening out there, that fairly modest investment in doing the right thing carries immense value and weight. I'm really, really pleased for home care workers and social care workers, so they've been treated with dignity and respect.
I've got four more questions to go on this particular session. Appreciate both questions and answers being pithy for the next section. Even if you've got a few questions, that's okay. Go for your few questions, but let's try and get through them all as quickly as we can. So I'm going to Ben first.
Thanks, Chair. So, I'm interested in the fairer contributions policies in reference to a report. So you've got £800,000 in income there, which is welcome. I'm interested in how this income's calculated. Is this from existing clients who are currently getting services, and what safeguards there are in place to make sure that everybody who needs it can get the services?
David can probably come in on the safeguards. I mean, clearly this is partly about new clients, but it's also about existing clients as well, and reviewing their contributions at the moment. It's clearly partly about debt management, where there's charging at the moment that we're not collecting, as well as new charges. But it's also about the whole process that we're going through around the assessment, identifying through that where people are actually paying for service they're not currently paying for, to ensure that we've got a level playing field between individual clients. So yes, it's that process. It's new clients. It's also what we're doing in terms of debt recovery as well.
Yeah, the safeguards are very, very tight on this. As you might imagine, there's been a lot of complaints to the LGO over the last couple of years about what we call contributions, what people call charges. for social care, usually those complaints come from folk or their relatives. So there's very, very clear guidelines that we can only charge from when the assessment process is completed, and we can't retrospectively make any charges. So part of this going forward is following through our entire programme of reviews on charges and means testing. There's a set national level below which we cannot go for anyone, and we never do. So at some point, if someone's means runs out, they become entirely dependent on the local authority for their care. And we've separated out in Southwark our financial assessment process from our care process. So when we have a conversation about your needs and how we're going to meet them, that is made entirely independent of whether or not you will pay a penny or whether you pay fully for your care. So although it all sits in adult social care, they're two separate processes. We always do the care bit first, and we do the money bit after that. And about between 40 and 45% of people who we financially assess end up paying nothing towards their care. They haven't got the means. They're living at a level where they're within the zone that government has determined they're entitled to receive services without any contribution in. And then the circa 55% of people have significant means or substantial means, and then do make a contribution under the national rules. So very, very, very tight safeguards, and it's going to be sensitive to.
Helen.
I just wondered if you both wanted to address some of those concerns that Duncan raised, particularly about all the pressures on our health departments in South East London, and how can we be confident of many of these aspects of the budget.
Well, I think that ties into some of the earlier questions that were about joint work with the CCG and the NHS. And I think, first of all, we've got the processes in place around Better Care Fund, improved Better Care Fund, which I think has got us to a place where we are sharing our planning more effectively with the CCG. I think the work we're doing around the integrated planning and development group, which is a joint group of both the CCG and the council, which I jointly chair with one of the vice chairs of the CCG, has done a lot of work to try and look at how we can address some of these issues and get to a better place in terms of integrated planning. We are looking at probably having a sort of shadow budget arrangement for some areas of our work for 18-19, looking to probably having, if we can, a joint budget arrangement for certain areas of our expenditure for 19-20. So I think we're getting to a place where we're talking the same language far more effectively. We've done a lot of work to try and, as Fiona covered, in terms of matching individuals in the system so that we are talking about the same people. I think there probably is a more existential pressure in all this, is what pressures there may be on the CCG which come from without Southwark. There clearly is, with their new restructuring, the emphasis on the sort of sub-regional approach of the NHS for the whole South East London model, and their STP is tied into all of that, and clearly within that there are pressures to try and resolve some of the budget issues there are at King's, for example, but also elsewhere in the system. So I think there probably is a risk of that. I think the way we mitigate that is by having that better relationship with the CCG and better planning with the CCG, so we're creating a pressure in the other direction to stop that becoming a sort of swipe from above, and making sure that people in the CCG are fully bought into it, because it becomes harder for them to do perhaps some of the things that happened previously where there's been calls on other parts of the NHS and money has disappeared from Southwark as a result of it. So I think we're in a more robust place, and that helps us.
Great, thank you.
I agree with that, but also, also say, the future looks incredibly challenging. So across South East London and indeed on our patch, we have NHS partners who are either forecasting massive deficits, huge deficits, or are reporting they will come in on budget. But when you look at the detail, you find they're using enormous amounts of reserves. I mean, many, many tens of millions of reserves that they won't have next year. I also think the targets that have been set for partners, in particular SLAM, are more than double than what they've ever achieved. I I don't think we as a system can be confident that we can deliver the kind of safe, high quality, good services that we would like to deliver without very significant investment. And I think there's no way of getting away from that. Working together will definitely help pooling budgets in shadow form, definitely, because I think it will expose the issues. But I wouldn't want to give the impression that we can achieve what we all expect of our public services, health and social care, without a lot more money. Because even in transformation, even if we're to get onto a more sustainable value for money footing, that transformation would cost many, many, many millions of pounds. And at the minute that's not clear, and it is beyond frustrating that the second part of the Care Act, which was introduced some years ago now, which was the funding of adult social care, has been put on the back burner year after year after year. We were promised legislation last year, and that was put onto the back burner to this summer. So the truth is, beyond 18-19 and the budget that members will consider in February, no one has a clue what funding is coming down the line to pay for the social care part of health. No one has a clue what money is coming into the NHS. So it's just enormously difficult to look to the future. We do our bit by supporting each other, and we work really, really, really hard to do that. And we have courageous and honest conversations where we need to have them. But I do think the future looks exceptionally challenging, because I think there's a truth that we just can't get away from, which is for the kind of high quality services with the kind of outcomes we're seeking, it's just not going to be, achievable with the reduced funding that we're facing. So until and unless that changes, I think the risks are really large in the system.
Thank you. We've got Jasmine and then Kieran, and
My
then
question has already been answered, Chair.
Oh. Gold star there. Kieran.
Thank you. I mean, incredibly important point you're making just then about the risks that we carry with not having the funding that we need from government. So it's deeply worrying, I think, for all of us that we have a country where we're not funding the health and social care system that we all want and need. I wanted to go back to the line about the pathways into disabled care. That's two questions. So one, you made what sounds like a very sensible description of bringing together services across all age groups. Made a huge amount of sense. I just want a little bit of reassurance that means that we're not going to create a different barrier with other children's services or other adult services. You draw the ring around somewhere, but that's just been taken into account. And then in terms of the £1 million of savings, if you could just give an indication of how that splits really across reductions in cost in our internal staffing costs, in the cost of care packages, or indeed in the cost of some people no longer being eligible for service. How does that breakdown split when in practice?
So I'll start with the second part, which is around the breakdown of costs. The programme that we've been working through around that £1 million, which is a continuation of this year's work and the previous year's work. I think members probably remember we had a £7.5 million saving identified over a number of years, if we go back a couple of years ago. This is all focused on the non-care elements of packages. So it's our negotiations with providers around the non-care elements of those packages. It's true to say that not that long ago in Southwark there was a fair bit of money in the system. It's true to say that providers were a bit cheeky with that. It's also true to say our commissioning was not as tight as it might have been in terms of value of money. Painful truth, but put it out there. Because what that means is it gives you something to work with. If you look at the savings that have happened this year in terms of the care packages, and this information is presented to the Budget Recovery Board every month, so we can see that for some people their care packages are going up because their needs are going up, and for others it's going down. But where the money's been saved isn't in that space, it's in the renegotiations with commissioners now and those providers to bring down high profits into a more respectful and affordable space. And so that £1 million will be through the normal programme of reviews, and the focus will be on non-care costs, making sure that we honour our eligible care costs. In terms of the All Age Disability Service, you're right to say it does mean we're growing the circle around all the care parts, so children with disabilities, transitions team, and adults with disabilities, both physical and learning disability. The bit that's still without for the first year, possibly 2 years, SEND, so our special education needs team, focusing around education. We've done that for a very particular purpose, which is we want to continue to work with our schools and with our partners to make sure that we follow through on the reforms that are happening there. You'll be aware that there's a transition from statements to education, health and care plans. That's also very much in play, and that team is focused, doing really well, but focused on that. So we wanted to get the care bit done first. So it's in 2 phases. First bit is all the care services, and then phase 2 will be when SEND comes in to join that service too. When we get there in about 2 years' time, we'll have the full package together. And in the interim, we've got folk from care on a board of SEND and SEND folk on the team when these changes, precisely to try and identify and mitigate those issues as they arise.
Thank you. Okay, thank you for that, both David and Richard. You can stand down, and we'll ask Councillor Mills to come up now. I should have mentioned this at the start. I will be standing down from the chair of the committee whilst Councillor Mills comes and speaks to us, because we're married, and so that wouldn't be appropriate. So I will hand over to Vice Chair Beth.